Hi, this is Louis Rios. I'm here in Austin trying to keep Austin weird, and I'm here with Johnny Franco. This is actually my first podcast, but Johnny's my inspiration. He's done a lot of podcasts, so he's going to help me through this. And so we're in Austin today, actually taking care of some politics, meeting legislators for the Texas Society of Plastic Surgeons, trying to talk about patient safety issues and all that. And we're going to go into that in a second. But I just wanted Johnny to introduce himself. And for all you ladies, this is a single plastic surgeon in Austin. So if you're ever in Austin, you should look him up. But anyway,
just trying to keep Austin weird, you know. No, I appreciate you having me. It's great for you to come all the way up and out of your busy schedule to come to Austin and do the TMA stuff. I don't think people realize how important this is. And I mean, you're taking time out of your busy private practice to come and do this really for the greater good of the state. That's going to be very little for you back home. So really appreciate it, and I know the patients thank you. So
yeah, and you know, I called up Johnny. He's one of my idols on social media, and asked him to come out and help, and so he decided to come out and help, and I really appreciate it because we are actually tackling some tough issues here that concern our patients. We're both board certified plastic surgeons with busy practices. And so we've heard stories from patients, or we've taken care of patients who've had some issues, and we'll get into that here in just a second. But the first thing I kind of wanted to talk about, maybe you can give me your experience in your practice, is there's an opioid crisis out there, and the last thing that a plastic surgeon would like to do after a surgery is to prescribe opioid medications to a patient and then get them addicted to opioids. You know, I think that would just be a disaster. We would hate that to happen to our patients. So maybe you can tell me what you do in your practice to try to reduce opioids, or are you even to the point where you're not using opioids?
I wish. I feel like we're working towards really minimizing the opioids that we use in our practice, and really working with the surgery centers, the anesthesiologists, and then our office. I think it's really become a team approach to decreasing that. I think just so people know, in our practice, it's actually extraordinarily rare that somebody gets addicted to opioids in the type of stuff we do, and that's why we do a lot of the things we do. And it's funny because I think sometimes we have to do a little tough love with our patients in terms of the amount of prescriptions, refills, other stuff we do, but I hope that in the long run people understand it's really in their best interest that we do this. It's easier for us to just give you another script. It's really hard for us to help coach you through everything, and so we are doing it for you. But in our practice, what we've adopted is actually getting people started on some medications that are non-opioids to help them with pain before the surgery ever happens. We actually start people on a couple different things the day before, the morning of surgery, and then we have some breakthrough opioids for pain for them afterwards. But I think you've been more aggressive than I am with something called Exparel, which people may or may not know about.
Right. So, and I think you talk about it in your social media, and we definitely show it in our social media.
And what's your handle again?
I'm Rios Plastic, or Plastic Rios, R-I-O-S.
And I watch you all the time, and I think you guys are great. It's a nice balance of like fun, but you also show real results, which I think are super important because it's what you do. And so people know, hey, I like this or I don't, and boom, there it is.
Right. I think that in social media, if we can just detract a little bit. You have the type of plastic surgeons or wannabes that jump around and dance and do crazy stuff, right? And I don't tend to do that. I mean, we show our personalities, right? We have hobbies, we like to do stuff, we like to talk. But surgery is a serious thing, and so I think our patients do appreciate that we have somewhat of a serious demeanor during surgery, but we still do show our personalities.
Don't you feel like your patients, come in with better questions because they've been watching for a long time? They kind of know what to expect. They'll bring little clips, little pictures off that and say, hey, is this possible for me? Why do you do this? Am I going to have this incision? And I feel like that really helps us have a more meaningful time together during the consultation.
Yeah, and I think also, you probably hear this, that the patients will come in and say, I feel I've already gotten to know you.
For sure.
I feel, I don't feel as intimidated coming to you. And then every once in a while someone will say something crazy. I feel like I'm talking to a movie star, which is, if you see us, we're not Brad Pitt.
Well, we're a little bit of rock stars.
Yeah,
we got a little bit rock star.
A little bit. But even then, if we go back to the opioids, I think by using social media, we're able to educate our patients, and like we can show that medication that both you and I use, the Exparel injection that we can utilize, especially during tummy tucks. It works great, right?
For sure.
So how long does the Exparel work for you in your practice?
Really, I think people get about a good solid 3 days from it, and if you can get them over that initial hump, I feel like they do really, really well. And so we actually don't give any of our tummy tuck patients an option. They get the Exparel just because I think it gets people up moving so much faster. And the old days of staying in bed for a week, have gone out the window years ago. So getting people up the night of surgery, walking the next day, I think the Exparel has made a huge change for them.
Yeah, and do you feel now that patients come and ask you for that medication because they're a little bit more aware, maybe or maybe are you seeing more patients asking not to use opioids, or can we reduce the opioid use, or I'm coming to you because I know you really try?
I don't get as many that necessarily ask for the injections themselves. I do think that they ask for the speedy recovery. And so I think they know that there's stuff out there, and so it may not be the exact terms, but I think that they see that there's some people who recover a lot faster, people who are able to bounce back, and so I think they do look for that. In this busy day and age, it's hard for people to take an extraordinary amount of time, and then if we keep people down for a long time, it takes them a while to get their strength and everything back up. So no question.
Yeah, and I think that especially with tummy tuck patients are so scared of the pain, and I think in general, as surgeons, we know the first 3 days are always pretty tough. So with the Exparel and some of these other options, I think we're keeping our patients from getting too deep into that hole where it's going to be hard for us to get them out. And so I think it's just been something great. And maybe if there's a bad side to the opioid problem, there's been a good side in the sense that we're trying to develop better strategies to help our patients from having problems with opioids.
No question. I know in my practice over the last 6 months to a year, I've changed to be more aggressive about preemptively attacking some of this, which I know you do the Exparel in a lot of procedures besides just tummy tucks, and sounds like the people have done phenomenally well.
Yeah, we use it in breast augmentation, breast implant surgery. We use it in liposuction surgery, and it's been very, very helpful. So Johnny, we were talking to a legislator today, and it's interesting. We'll just talk about this just for a second, how right now there's not really a comprehensive plan in Texas. So we're, to help with the opioid addiction. So it seems like maybe we're a little bit behind some of the states, maybe a little ahead of other states. And so what key points did you hear today from the legislator we talked to?
I think it's a couple of fold here. One, it's awareness, and I think patients are more aware of it, and I think us as physicians got to keep pushing that. I think as physicians, making sure that we're an active part of this in terms of the progress forward, and helping educate people ahead of time. I think doing a lot of things that you're talking about in terms of whether it's other medications besides opioids, whether it's the Exparel, whether it's other methods to really help control pain. And so I think the biggest things were the awareness, and then the education and kind of multimodal treatment of patients to really help that.
Yeah, so I think we're probably going to see some good legislation come out where we're going to get us kind of going in the right direction, right?
I think we're going to there, but correct me if you think it's wrong. I've seen a big change from the surgery centers, from the hospital, from even physicians locally here in Austin, that people have started to make a change on their own even without the legislation. I think legislation will push the other kind of remaining half, but I feel like there's been some movement already.
Yeah, and I think that's why our society, the Texas Society, is very important, because we're not only here in Austin, but we're also going to be spreading this other way of doing it to the surgeons who don't know. A lot of our plastic surgeons do know this, but we're going to distribute protocols and different ways of doing it so we can get more education out there for our patients.